Some of the most common questions we receive here at Medical Athletics are, why should I stop the current concussion testing that I'm using and switch to your system? Or what makes your system so much different? The heart of those questions really are, why is our system better than what you're using now? And to understand that, we need to talk about what goes into our analysis. Here at Medical Athletics Sports Services, we can call ourselves MAS for short. At MAS, we have a analysis system that really begins with our software. And this is designed to understand what's happening in your brain. And this software we developed specifically for this purpose. And it looks at three broad areas. The first lets us collect information about the brain. And to do this, we use a computer-based neurocognitive testing tool that is not susceptible to the practice effect. The practice effect is what happens when someone repeats a test often enough and they begin to anticipate what the questions will be so they can give the answers they want and not what the test is designed to study or understand. An example of this is quite simple. So, an athlete or family member really wants to be in the game, really wants to support the team, support their friends, support other players, just doesn't want to miss that key play that may win or lose the game for the school. So, what happens is before the test, and a number of these tests you have to take before and after a suspected concussion. So before the test, they will artificially lower their score or miss questions on purpose so that when they take the test after a concussion and their thinking isn't as clear, they're going to miss questions. But if the answers are relatively the same, or the number of answers, then it looks like they don't have a concussion. And there's been no change in the test, in the score, or outcome. So with our test, you can't do that. You can't artificially lower the score so it looks good after. That doesn't happen. And in fact, we don't even need to take a test before you play to get the answer if you have a concussion. So that's one aspect. The other thing that we do is we perform our Medical Athletics Response System, or MARS, testing. And this tool gives us more information about how your brain and body are interacting together. Additionally, we scan the brain's vasculature with our bioscan technology. We also check the player's heart. This makes sure it's truly safe to play. So we take all of this information about your brain's data to determine what's going on in your brain so we can understand how your brain is functioning. And understanding the way your brain is working allows us to determine the depth of TBI or concussion. And our software then generates the Medical Athletics Concussion Index, or MAC-Index. This score is a number between 1 and 10 that tells our doctors how bruised your brain is or if there is a concussion at all. The Medical Athletics software collects data about your brain by using a practice-proof neurocognitive test, MARS testing, and bioscan technology to understand the brain's blood flow. Your athletic trainer or coach can use our heart ultrasound to tell them if it's safe for you to play. And all of this data gives us an image of your brain, as we see here. And this allows our doctors to understand what's happening with function. And our proprietary software tells us if there's concussion and how bad it is. So if the question is, do I have a concussion? The response should be, here's your score. Now to us, your brain is more than just electrical activity and points of light. We see data that tells us about concussion, TBI, and how that brain functions all together. And that's what makes us different. So we look at function and not just structure. And this is the data that allows our doctors to understand your brain. Data that lets us know if your body and brain are working well together in situations like a game or at a party, when you're with your friends, or even when you're taking a test at school. So why is all this important? Well, it gets to the difference between our brain evaluation process and what teams and health professionals use now. How well does your brain function? Because without good function, you can't do simple things like read a book, recognize your favorite person, or make change after buying dinner or a meal. And all of these things help you make it through the day. And tests like MRIs and CAT scans, they don't help because often they're normal after concussion. And they may always be normal, even when your doctor knows the brain is concussed. But the pictures are very pretty. They're very beautiful pictures. But here at Medical Athletics, we want data. We want information about your brain. We want to look at all those points of light, as beautiful as they are, and turn them into numbers, turn them into data, into software, so that we can extract information about it, so that we can give it a score and a number. So the question becomes, does your current test see the complexity of your mind and all the information about it and know what's going on? Can your test give you a score of how good your brain is? Can your test see if there's a problem developing? Can your current test alert your doctor to trouble, just like if he drew blood and there was a blood test? Will your test warn you or your doctors early, or will it be too late? That's really what it comes down to. Because in the end, it's your brain, your child's brain, and the question is, will you let us make it the best brain possible?